Hello, I'm Rose Diaz, I'm intern, and I'm here to talk about post-tPA ICH in instinct community hospitals versus pooled analysis. So we can see that intracerebral hemorrhage is a challenge that physicians must face when treating ischemic stroke, with the balancing act between the clinical benefit of fibrolytic therapy versus the inherent risk of a post-thrombolytic intracerebral hemorrhage. Here we can see the CT scan of a 54-year-old woman who came in with an ischemic stroke and was treated with tPA, and this is her CT scan 1 day later. This is the exact outcome that we're hoping to avoid when treating our ischemic stroke patients with tPA. There have been, though, some settings where there's low rates of post-thrombolytic intracerebral hemorrhage, and in those settings there could be clinical research trials, also some community hospitals where primary stroke centers are certified, and also community hospitals who participate in the Get With the Guidelines stroke program. But the rates of the hemorrhagic transformation in community hospitals outside of these descriptions hasn't been a really popular subject for investigation until the INSTINCT trial. So the INSTINCT trial randomly selected 24 hospitals in Michigan for a prospective cluster randomized trial, and the research question was, with some comprehensive barrier assessments and standard multi-component interventions, could we enhance the use of tPA in community hospitals? And these 24 dots are representative of the hospitals that were chosen that were randomly selected to participate in the study. So the primary outcome was that there was not a significant increase with those interventions of tPA use in these community hospitals. But what the study did do is yield a really unique data set that would allow us for a secondary outcome analysis. And for this secondary outcome analysis, we wanted to see if this large representative sample of community hospitals in Michigan, who were all tPA treated, how they compared with these large clinical trials of IV thrombolysis, the NINS, ECAS, Atlantis, and EPITHET trials. The methods that we used to choose these community hospitals, they were randomly selected, and so we started with 104 acute care hospitals in the lower peninsula of Michigan, and 43 were excluded, either because they had less than 100 stroke admissions per year, they were academic stroke centers, or they were affiliated with the University of Michigan. Also excluded one hospital that had greater than 100,000 visits to the ED department. So of those 61 that were eligible for inclusion, 5 declined to participate, and 32 were not randomly selected, leaving us with 24 hospitals that were randomly selected to participate in the INSTINCT trial. So these community hospitals are 230 bed average hospitals. They have approximately 100 stroke admissions per year. They're not academic stroke centers, and they're less than 100,000 ED visits per year. And to identify ICH in these tPA treated patients, there is a primary and secondary review of the data. And in the primary review, independent physician panel reviewed the complete medical records of these tPA treated strokes from the period of 2007 to 2010. And from those files, any evidence of possible ICH was subjected to a secondary review where 2 vascular neurologists who were blinded to the original interpretation classified each possible ICH using ECAS criteria. ECAS criteria is the European Cooperative Acute Stroke Study, and it introduced a grading system that classified these hemorrhagic transformations into 4 categories: hemorrhagic infarction 1, hemorrhagic infarction 2, which both have no mass effect, and then the parenchymal hemorrhage 1 and parenchymal hemorrhage 2. And of those categories, PH2 has a definite mass effect with greater than 30% of the infarcted area involved. And we're most interested in PH2 because this has the most clinical significance. In PH2, there can be a devastating impact on early neurological course, and it's also shown an increase of 3-month rate of death. So when we collected this data for the original INSTINCT trial, we wanted to make sure that we were gathering all of our pool of randomly selected Michigan hospitals and identifying all of the cases of ICH. And we found that the data was very robust. Had 100% capture, so we were able to de-identify, abstract, and analyze records for 557 patients who were treated with TPA. And we were able to overall have 99% of individual data fields. And also the inter-rater agreement for coordinator was very high, 94 and 96% overall. And there's also good rate of agreement between the physician reviewers, 98%. And so in analyzing the results, you can see from the INSTINCT trial, we had 462 patients that were treated with TPA here in the local community hospitals in Michigan. And of those, 63 had ICH of any type, either the HI1, HI2, the PH1, or PH2. And of those, the PH2 that we're most concerned about, there was 17 patients identified, so 3.7% of the total patients treated. And in the pooled analysis cohort result, of the 464 patients that were treated, there was a total ICH rate of 37.4 with 161 patients identified, and the PH2 rate was from 22 patients, or 4.7%. So when we're comparing the INSTINCT results versus the pooled analysis cohort results, we see that there's a 3.7% rate for INSTINCT in community hospitals and a 4.7% rate in this pooled analysis cohort result. So we're believing now that there's no difference in the PH2 rate between these INSTINCT community hospitals and the pooled analysis cohort hospitals. So we can conclude then that the overall ICH was actually lower in these community hospitals who were participating in the INSTINCT trial compared to the pooled analysis hospitals who were in the NINS, ECAS, Atlantis, and Epithet trials. We can also see that the incidence of PH2 in hospitals participating in the INSTINCT trial was not different from rates reported in large clinical research trials, and the confidence intervals are low, supporting the safety of the community treatment of stroke. These are my references, and I'd be glad to answer any questions.